I am really privileged and honored to be with you all. Marami pong salamat sa Department of Education for inviting me today and for inviting POPCOM to present the situationer of the adolescents here today. If you have heard po of the Young Adult Fertility and Sexuality Study, so we will present po the current adolescent and youth health situation in the country. All right. So if you could see, since I'm from the Commission on Population and Development, of course, I need to present about our population. So currently po, we have 109 million Filipinos. And then as you could see, we have a relatively young population. Filipinos age 0 to 14 comprises 31.8% of the population. And then the Filipinos age 15 to 64 working age comprises 63.4% of the population. And as you could see po, we're really far from aging because only 4.7 of the Filipinos currently age 65 and above are aging. All right, so this is based on our population pyramid for 2015 census. So our official count po is really 100 million Filipinos based on the 2015 census of population. Pero yung projection po, we are 109 million Filipinos. Okay, and then the share of the youth population to the total population has remained stable at 20% between 1960 and 2015. So now po, let's talk about sex. So if you could see, 1 in 3 Pinoy youth has engaged in premarital sex. All right. So you could see po na that in terms of absolute numbers, that's a very, very huge number kasi it will really go through millions kasi 1 in 3 has engaged in premarital sex according to the 2013 Young Adult Fertility and Sexuality Study conducted by the University of the Philippines Population Institute. So this is the series of and the only authoritative study on reproductive health of the Filipino youth aged 15 to 24. So we have also found out based on that research that premarital sex between young men and women is narrowing. What does that mean? The Filipino girls are catching up in terms of premarital sex. All right. And then the highest levels of premarital sex is in NCR. Of course, that's understandable because of the city. Okay. And then Central Luzon. And then lowest in ARM. Actually, Bangsamoro Autonomous Region of Muslim Mindanao na po siya ngayon. Pero, of course, noong 2013, it's really Autonomous Region in Muslim Mindanao. Why is it lowest there in ARM? According to research po, because there is early marriage in ARM or BARM currently. Kaya po lowest yung premarital sex because they marry young because of the prevalence of early marriage. Okay? And if you could guess po, where is the first sexual encounter kaya of Filipinos? According to research, the first sexual encounter of young Filipinos are at home when the parents are not around. Okay, and then of course, since it's at home, 78% of the first premarital sex was unprotected against the risk of pregnancy and or sexually transmitted infection. So the study also asked, how about your first sexual encounter? Was it planned, or did you went along with it anyway? So majority of the those who were asked, the Filipino youth responded that they went along with it anyway. So majority of the first sex was unplanned, but majority occurred at home. Okay, so of course, since it's unplanned, 78% of the first premarital sex experience was unprotected against the risk of pregnancy and or sexually transmitted infection. Okay, of course, since it's unplanned, um, majority of the unplanned first sexual encounter who did not use any form of protection, usually, of course, dapat condom yan kasi first premarital sex. So 83% are females, 73 0.4% are males, as you could see in the graph. Okay, so that's very dangerous po kasi of course we know that even if it's the first time, but when a female is fertile on that first time, she will really get pregnant. Okay, even if they had only sex once, but nagkataon po na she was fertile at that time, so of course she will get pregnant. Okay, and then of course it's the danger of sexually transmitted infection because they did not use any form of protection. Okay, so now we go on to fertility knowledge. So the study also asked about the knowledge of females about conception. Okay, and then 75% believe that a woman can get pregnant from one unprotected sex. So that's very dangerous because, ano po, sabi ko nga po kanina, even if it's once, pero pag fertile po yung babae, she can really get pregnant. But 75% of Filipina young girls believe that, okay, na yung unprotected sex, ayun, they can get pregnant. 37% do not think that a woman cannot get pregnant when she engages in sex anytime during her menstrual cycle. Ito po, dangerous din because ano pong ibig sabihin yan? Okay? So, ibig sabihin, may mga babae po kasi na iba-iba po ang cycle nila. So, tinuturo po yan sa natural family planning na may mga babae po na kapag po short cycle, if kahit po na may regla siya, maaari po siyang mabuntis. Okay? So, napakalaki pong number yung 37% do not think that a woman cannot get pregnant when she engages in sex anytime during her menstrual cycle. Kaya po yung traditional methods of family planning like calendar does not work kasi a woman po, iba-iba po talaga yung menstrual cycle niya. So, if nagkataon po short cycle siya, so tas nakipag-sex po siya doon at meron po siyang regla, she can get pregnant. Okay, so that's a misconception. And then another one is 42% agree that a woman cannot get pregnant if her partner did not ejaculate. So what does that mean? Kaya po napaka-prevalent ng withdrawal kasi um, almost half believe that if the partner did not ejaculate, a woman cannot get pregnant, which is wrong po. Okay? We call that pre-ejaculation. So, yun po, dapat ituro talaga. Kahit po ngayon, helpline responders po kami sa POPCOM. So, may ang common questions that we really encounter, even from adults, um, are the misconceptions po on withdrawal talaga. Kaya we always warn them na since now nasa tayo quarantine, and if you cannot get family planning, do not practice withdrawal talaga kasi a woman can get pregnant for withdrawal. Okay? Next. Okay? Okay, so about teenage boys naman, teenage boys desire to have 3 children on the average. And then, as you could see po, if this future cohort of fathers will achieve their desired fertility, wala talagang significant fertility decline kasi Filipino men want 3 children on the average. These teenage boys who will one day become fathers and become adults. All right? So, about teenage girls naman, females prefer to have 2 children. So if you could see po, meron pong disconnect. Kasi yung boys want to have 3 while the girls want to have 2. So sino po kayang masusunod? Is it the male or the female? Okay, so ayan po. And then, the truth about teenage boys, about 4% of single teenage boys have gotten someone pregnant. Okay? So, that's very dangerous po kasi teenager, tapos 4% of them have gotten someone pregnant. And then, half of married teenage boys, ibig sabihin yung age po niyan is 18 and above. Of course, you can only get married once your age has reached the legal age, no? So, half of them admitted that they have ever gotten someone pregnant other than their spouse or their partner. So, ibig sabihin, yung current partner that they have now, meron pa silang ibang nabuntis. So, very dangerous talaga po ang nangyayari sa ngayon. Okay? And then let's move on po to children having children or teenage pregnancy. So in the DepEd sponsored the National Teenage Pregnancy Summit, Our then Secretary, NEDA Secretary, by the way po, yung Commission on Population and Development is under the National Economic and Development Authority. So then, at the Teenage Pregnancy Summit, NEDA Secretary Ernesto Pernia has declared that teenage pregnancy in the country today is a national social emergency. Okay, kasi po malalaman po natin na tumataas po talaga yung mga bilang ng mga bata na nanganganak ng another bata, okay, or children having children. So very alarming po yung nangyayari. And currently po, dahil lang po kasi nagkaroon tayo ng COVID-19 pandemic, pero before this, we were really campaigning that the Teenage Pregnancy Prevention Bill be passed po para po magkaroon pa ng mas maigting na pagpapalaganap at pag-implement ng batas tungkol dito sa teenage pregnancy. Okay, and then as we could see po, the Philippines is the only country in Southeast Asia where teenage pregnancy rates are not falling. So, gold medalist nga po tayo dyan when it comes to teenage pregnancy. As you could see, yung mga neighbors po natin, like Singapore, 2.7, Philippines, napakalayo po, diba? 57, okay? So, our teenage pregnancy births are really not falling, okay? And then, but there's a good news because there's a decrease in the proportion of women aged 15 to 19 who have begun childbearing. So from 2013 National Demographic and Health Survey na 10%, sa 2017 National Demographic and Health Survey, nag-decrease po siya to 8.6%. But that's still a high number. Okay? Kasi po, ang mga kabataan dapat hindi nabubuntis kasi hindi pa po ready ang kanilang katawan to bear a child because they're still children. Okay? And then when it comes to regional adolescent fertility, as you could see, the incidence of teenage pregnancy is really highest in regions 11, 10, and 12. So kailangan po natin pag-aralan bakit kaya mataas ang teenage pregnancy sa Davao Region, sa Northern Mindanao, at sa Soc-Sargent. Okay? Sa Soc-Sargent po, it might explain because there's early marriage, so there's also early teenage pregnancy. So kailangan po nating i-determine ano po ba yung meron sa Davao Region and Northern Mindanao Region, why teenage pregnancy is highest in those three regions. Okay, so you could see po there that ang ating national average is 8.6. Sa NCR, ang teenage pregnancy 5.6. Okay, but doble po yung nasa Region 11. Okay, so more than double pa kasi 17.9% yung who have begun childbearing for women aged 15 to 19. Okay, and then rural teenagers start childbearing slightly earlier than urban for those at the urban areas. So makita po natin na mas madami po talaga yung mga taga rural areas na nabubuntis kaysa dun sa mga nasa urban areas. Actually po, this research has also revealed that education is always a protective factor against early sexual engagement and of course early pregnancy. Kasi education po, kapag po nag-aaral yung bata talaga, the child is exposed and her vision, her point of view is widened according to research. That's why ito pong pagbubuntis ay medyo nakikita na protective factor kapag nasa school at nag-aaral yung kabataang ito. Okay? And then when it comes naman to vital registration or those who are having their births registered, very alarming po na ang youngest recorded age of mother at first birth was at age 10. So napakabata pa po, 'di ba? Isipin po natin nung 10 years old tayo, anong ginagawa natin? Nagbabahay-bahayan pa. Pero ito, the youngest recorded age of mother here in the Philippines is at age 10. Okay, so very alarming po. Pero meron din pong anecdotal data na nagsasabi na meron pong abuse involved dito sa, of course, less than 18 because They are not ano pa legally capable talaga to decide on their own, and then yet they get pregnant. So may mga anecdotal data po na nagsasabi na there's abuse involved usually for those kids like 10 who give birth. Okay? And then of course the incidence of teenage fertility generally grow rapidly after age 15, as you could see po. Okay? So right now, noong 2017, ito po yung available data, 10 years old, 22 cases na for the entire Philippines. Tapos ilang regions lang po tayo meron. So kahit isa per region po, napakadami pa din yan kasi 10-year-old yan. And then, as you could see, it's increasing as the age goes up. Okay? So tignan naman po natin yung mga batang ina. Ano ba yung mga profile nila? Two-thirds are in living-in arrangement. Of course, when you are in a live-in arrangement, you are exposed to sexual activity. So, ang pinakamahirap po dyan ay nabuntis ka na ng bata, tapos masusundan pa po ulit or repeat pregnancy. So, ano pong ibig sabihin yan? Sana po kung mabuntis din yung, before mabuntis yung bata, na-reach na natin sila. And then, pag nabuntis sila, ma-reach natin sila na hindi po sila mabubuntis ulit. Okay? And then more than a quarter or one-fourth of them are below age 18. Mostly high school undergraduate or high school graduate. So, sabi ko nga po kanina, yung research ng Young Adult Fertility and Sexuality Study has revealed that education is a protective factor against teenage pregnancy. So, makikita po natin na majority ng mga napupuntis ay hindi graduate ng high school or graduate ng high school, hindi na po nakakapagtuloy sa further study. And then for our batang ama, of those who are married, more are in a live-in arrangement than in a formal union. About a fifth had no schooling or with an elementary education. So 18% po ng nakakabuntis na mga kalalakihan ay hindi po nakapag-aral or nagkaroon lang po ng elementary education. Majority were raised by both parents, but quite a number, like 7% were raised by solo parents, 4% by one parent, and another person, while the rest were raised in alternative setups, raised by people other than their biological parents. Research has also shown po na yung mga kabataan, kapag hindi po nag-guide talaga at home, most likely po sila po din yung nakakabuntis or nabubuntis kasi kailangan po talaga ng guidance ng magulang. According to the Young Adult Fertility and Sexuality Study din po, 10%, only 10% of Filipino parents discuss sex with their children. Kaya sana, yun sana yung gusto nating ma-attain, na sana yung mga parents mismo yung makikipag-usap about sexuality with their adolescent children. Start as simple as calling our private parts as they are. Do not call them flower or bird, diba? Call them vagina or penis. Yun, it could start as that simple. All right, or it could really start with teaching about good touch and bad touch. If you teach your children to protect themselves, okay, bago po yung about sex talaga, or as we call about the birds and the bees. Okay? So this is how we do it po. We approach teenage pregnancy through a framework. We know that ang isang kabataan po na nabubuntis ay hindi lamang produkto ng kanyang sariling desisyon. Of course, may desisyon po siya, pero ang kanyang desisyon at naging consequence ng kanyang desisyon ay nai-influence po ng napakadaming factors. Okay? Una, okay, doon po sa malapit-lapit sa kanya, ang kanya pong age at sex, okay? Ang kanyang marital status, kung nasa live-in arrangement siya, kung nasa rural or urban area siya, naging influence po yan sa mga desisyon niya. Okay? May mga psychosocial factors po na nag-influence. Bakit po siya nagiging pregnant? So, pwede po siya sa yung kanyang identity, gender identity, ang kanyang self-esteem at self-acceptance. Kaya po gusto po natin sana yung mga kabataan, meron po silang life skills. So, ano-ano po ba yung mga life skills na gusto natin na matutunan ng isang bata? We want them to learn the skill of negotiation. Na when you have a boyfriend, you negotiate na hindi po magpapadala sa pressure yung babae na pag sinabi ng lalaki na the usual po, if you really love me, you will give yourself to me, yung mga ganyan po. And then we want them to have the life skill of saying no, the ability to manage stress. Okay, so ganyan po yung mga life skills na gusto natin matutunan ng mga kabataan. Of course, it's also, her decision is also influenced by her access to media. Kasi po, according to the Young Adult Fertility and Sexuality Study also, na kapag yung isang kabataan ay exposed po sa pornography, more likely may relationship po yun sa kanyang early sexual engagement. Of course, what is in your heart will eventually manifest itself in the way you act or in your actions. So, what is in one's mind, heart, will eventually find itself in action. So, yan po. Of course, yung media use po ng mga kabataan ay nararapat din nating talagang bantayan. Okay? Kasi malaki po ang influence ng access and exposure to media sa mga kabataan ngayon. Like also po, kapag po yung mga kabataan, aside from access to pornography, the music that they listen to. Okay? So, kailangan po, as adults, we are also very vigilant on our adolescents right now. Okay? And then, kasi maaari po na hindi natin nababantayan na yung mga pinapakinggan po pala nilang mga music, really goes into their hearts and minds, no, and influences them. And then socioeconomic factors, yung the family that they have currently, okay, it affects their decisions and their exposure to teen pregnancy. Okay, and of course, sabi ko nga po, ang isang desisyon about early sexual engagement in teenage pregnancy, aside from the individual factors, it's also influenced by, of course, parental guidance, all right? And then yung knowledge, attitude, and practice niya on sexuality and adolescent reproductive health. Yung parental values that he or she has, na kapag yung parents di naman nagtuturo about the right principles, 'di ba? The principle of really postponing muna early sexual engagement or responsible sexuality. Okay? Or hindi na-regulate yung access nila sa media, that influences a young adult's decision. And of course, aside from the family, there's a community that this young girl and young boy live in. The peer influence, according to the Young Adult Fertility and Sexuality Study, ang mga peers po talaga influences the young boy and girl, young boys and the young girls' decisions, no? And their most preferred sources of information on sexuality is really their peers. Pero of course, we know na better po sana kung mga authorities sa buhay ng isang kabataan ang kanyang source ng information about sexuality and sex, no? Hindi po yung kapwa niya kabataan. Okay? And then, of course, yung policy and program environment that this young girl and young boy live in. Kaya po gusto natin na sana mapass yung Teenage Pregnancy Prevention Bill kasi we want na meron po talagang law para ma-protect itong mga kabataan against early sex para po matulungan sila, maturuan sila. Okay, and if they get pregnant, na sana makapag-access sila ng family planning kasi we know po na sa Responsible Parenthood and Reproductive Health Law, kailangan po kasi pag under 18 ka, kailangan merong consent ng parents kapag bibigyan ka ng family planning. Siyempre po, pag buntis ka na, tapos, or bata ka pa, tapos nakikipag-sex ka, syempre po, hindi naman po kayo siguro lapit sa magulang nyo para humingi ng consent. 'di ba? Para, "Nay, tay, hingi po ako ng consent kasi nakipag-sex po ako mamaya, kailangan ko po ng condom or ng pills." Siyempre hindi 'yun gagawin ng bata. Kaya isa po 'yun sa mga very controversial na provision ng Responsible Parenthood and Reproductive Health Law na sana gusto natin na kapag nakikipag-sex na yung bata, of course, sana meron siyang access po sa family planning. Kami po sa Commission on Population and Development, ABCD, ABC pa rin po talaga yung ABCD ang aming stand. So, abstinence pa din. Of course, we want young girls and young boys not to really engage in early sex. Okay? We want them to really develop muna their self-efficacy. We want them na ang core message talaga namin, piliin mo yung pangarap mo, wag mong ipagpalit sa sandaling sarap. Okay? So, piliin ang pangarap, wag ipagpalit sa sandaling sarap. Abstinence pa din. Pero, and then letter B, of course, be faithful. Kasi kapag marami kang sexual partners, of course, you are exposed to the risk of sexually transmitted infections, and that includes HIV and AIDS. Actually po, sa ngayon, yung mga majority ng nai-infect sa HIV and AIDS are really young males having sex with their fellow males. And they are young, nasa age group po ng 15 to 24. Very alarming po na sana yung mga kabataang ito, 'di ba, hindi po risky yung kanilang sexual behavior, that they be faithful or have really one partner, and C po, use condom kasi condom is the only family planning method or contraceptive, the only contraceptive po that will prevent against sexually transmitted infection sa tamang paggamit po. No? So yan po yung mga core message namin. And then letter D, don't drink, don't smoke, and don't do drugs because according din po sa Young Adult Fertility and Sexuality Study that those who are drinking, smoking, and doing drugs are more likely, and my relationship po doon sa early sexual engagement or sex engagement, and of course, teenage pregnancy or sexually transmitted infection. Ayun. Okay? So, ayan po yung causal framework for teenage pregnancy that we are approaching as we implement and understand this issue of teenage pregnancy. Kasi po kami po sa POPCOM, isa po to talaga sa mga malapit sa puso namin because adolescent health and development is really one of the program components and program strategies of the Philippine Population Management Program. Okay? And later on po, I will present some strategies on what we do to prevent early pregnancy. Ayun. Again, marami pong salamat for the opportunity. This is a short presentation on the current status of the Filipino youth's reproductive health situation. Ayun. Marami pong salamat.